Well, we wanted to welcome everybody to our July webinar. So I think we've done 5 or 6 of these now. And if you don't have the chance to see them or want to go back and see our other ones, we've done a number of body parts, and those are all listed on our website. So happy to have you guys go and access those at any time. And again, we'll continue to do these every month, usually towards the end of the month in the foreseeable future, so that we can get you guys the education that you guys have been asking for in order to know how to use the device accurately and most efficiently in your clinics and practice. So the topic for today is focusing around hip techniques. So again, with the shoulder and the hip, because there's 6 different motions for us to test, we like to break those up into 2 webinars. So this will be the part 1 of a 2-part hip webinar. Today, we'll focus on flexion, abduction, and external rotation. I wanted to introduce 2 of our speakers that were willing to come on with us today, Dr. Christi Williams and Dr. Kevin Robinson. They are both faculty at Belmont University, a PT school called Belmont University. And I'll give Christi first, just maybe 30 seconds to introduce herself, and then we'll pass it over to Kevin.
Hi, everybody. I am Christi Williams and practicing physical therapist, primarily an outpatient orthopedic physical therapist, and professor at Belmont University. And at Belmont, Dr. Robinson and I teach a lot of our basic clinical skills of palpation, goniometry, manual muscle testing, and handheld dynamometry is a big part of what we teach now as well.
Awesome.
And hello, I'm Kevin Robinson. As Christy said, we're both faculty members here at Belmont University in Nashville, Tennessee. I also am a practicing clinician. My areas are orthopedics as well as gait assessment. I use a 3D motion capture system with that. So I look forward to spending time with you today.
Awesome. And for those who haven't jumped on our previous webinars, my name is Daniel. I am the physical therapist who helped design and build a lot of the product and what it looks like today. My story really is after I got out of school, I realized that there were better ways to assess strength and range of motion in patients than the basic 0 to 5 manual muscle test score. And so we set out with Active Body to create a device that is easy to use, but also something that allows you guys to get better information on your patients and kind of drive better patient care. So the outline for the webinar today is, again, we briefly introduced our topic above. We'll dive into overview of how to test each direction. So again, the topic today is flexion, abduction, external rotation. And then we'll pop over to Kevin's portion. He will look at a couple patient cases that he's recently seen and how he's helped them using the handheld dynamometer or the ActivForce 2. And then lastly, we'll pass it over to Christi to go over their book or their textbook that they have been working on for the last, is it a couple years now or a couple years now? That Active Body is proud to promote and help spread the word on this amazing textbook that they've created for us. Here again, so starting with hip flexion, we go over some brief anatomy here. So as many of you know, because a lot of you have either are currently teaching in physical therapy schools or practices, or have gone through anatomy in the past, I just want to do a brief overview of all the muscles that flex the hip. So as you can see over here, it's a pretty well-known cross-section of a drawing of the musculature of the hip. As you know, these hip flexor muscles help flex the hip or bend the spine. The primary hip flexors are the iliacus, the psoas major, the rectus femoris, the sartorius, and the pectineus. And here's some descriptions about where they connect. Again, the iliacus connects to the pelvic bone and then runs to the thigh bone. The psoas major connects to the low back and also attaches to the thigh bone. The rectus femoris attaches from the pelvis to the knee. And this muscle in particular is a two joint muscle. So it also helps in extending the knee. And then the sartorius is also a two joint muscle as well. And then the pectineus is another muscle within the hip joint area. So just a quick review, you can see where some of those muscles are here. And then we'll go into how to test the specific motion. So this test, again, the way that ActivForce has regularly taught how to do these is we want to give you guys the freedom to test each joint position in a position that fits best for your patient. If you're just measuring and comparing symmetry from left to right sides or time to peak force, right, you can really test some of these muscles in any position, whether you're in the acute care setting and want to test in a supine or a sitting position, or if you're more in a outpatient setting and you want to be a little creative in a standing or sideline position, depending on what you guys decide to do. Now, we have a couple settings that are most commonly tested, and I have some videos here that our partners at PhysioU put together that I'd like to show you. So we'll start with hip flexion without the strap and seated. So as you can see with this test, they're placing it above the knee. They're controlling how far the patient is leaning back, and they're placing the device 2 finger widths above the kneecap. They're then having the patient push into the device as hard as possible. Again, you see the therapist is using leverage in order to stabilize the device as much as possible so that it doesn't move during the test. And that's how you would do it without the strap. Now, this is how I normally do it. You can also, if you have the time and the equipment to do it, you can get an even more accurate measurement, especially if the muscles are producing over 40 pounds of force. You usually want to, or you almost always want to strap the table down to an inanimate object. With this case, you're able to then use the strap to isolate the device or make the device still while the patient pushes into the device, and this allows you to get a more accurate measurement. Before I go on to supine, I wanted to give Kevin or Christi the chance to maybe give some of their insight as they've done this test many times, either in the clinic or teaching students in the classroom.
Well, and we teach in our program to always use a belt for stabilization whenever possible. The reason for that is a lot of times, honestly, the therapist is smaller than the patient. And if you look at the literature, it's actually shown that I think you mentioned earlier that if you're giving a force more than 40 pounds, regardless of the size of the therapist, you'll need a belt to stabilize. But it also makes things comparable from time to time. Plus, the majority of the normative data that have been collected have been used with the stabilization strap as well. So it just helps makes things a bit more consistent. But like I said, when push comes to shove, especially like in a home health environment, that may not be a good option. And in that case, then, like always in the clinic, you make it work. So.
Yeah. Awesome. Love that input. Thanks. Lastly, again, if you're testing in a supine position, you can test here. There's ways that you can anchor this down that are not showed here, but or to anchor it around your body and so that you're not using your force or the muscles of your arm to try to block or resist the pressure produced. Good. And as you can see, they're having the patient push into the device. And that's another way to test hip flexion. Okay.